So that's a model of the pelvis of a dog with the spinal cord, and we do the spinal anesthesia right here. That's the seventh vertebra, lumbar vertebra, and then the sacrum. The exact position of the needle is right here. The legs of the dog are stretched forward. That way, this little space between the L7, S1 gets a little bit wider. Then we introduce the needle a little bit, and there are two techniques. One of the techniques is when we do the hanging drop technique. We put a couple drops of the fluid inside the needle until we see the last drop on the top. Once we get into the spinal canal, in the epidural space, the drop disappears. It's getting sucked inside the spinal canal. And there is another technique when you use a little bit of gas inside, a little bit air inside the syringe. So when you compress, the air compress, but the fluid doesn't go if you're not on the right place. So you introduce the needle, you compress, nothing's happening with the fluid, it doesn't flow, the air compresses, which prevents injury on the spine if you penetrated the spinal column. So these two techniques can be used. I combine them, and then that's I think safer for the patient when you do the hanging drop plus this air inside the syringe for safer injection of the spinal injection. And again, that's the pelvis of the dog. The injection is happening right here between L7, S1, sacral 1, and then lumbar 7th vertebra. And that's pretty much everything.